Good morning. Welcome to the 13th McKusick lecture. I'm Jeff Sanders, the president at Maine Medical Center, and it's my distinct privilege to be with you this morning and to welcome our 2025 medical school class of the Tufts Main Track program. One of the things we set out to do many years ago when we started this program with Tufts, which has just been an incredible partner for us for medical education here in Maine, was to try to make the cost of the medical education affordable to those who attended our program, who had ties to Maine. So we set out to raise money to support scholarships, and I'm privileged to share with you over the next few slides, individuals, foundations, and our state that has supported scholarship support. To date, we sit about 70 scholarships that are either fully endowed or partially endowed. Our goal is to endow 80 scholarships for 20 students per year who attend this program. We're well on the way to doing that. I think a great shout out and thank you to our community to supporting the students here at the Main Track program. It's also a privilege to be with you today to talk about the impact this program has on our state. While the students will spend time here in Portland, the students will spend time in clinical rotations throughout our healthcare system and throughout our state, which as we look at our vision of making Maine the healthiest state in the nation, this program plays an incredibly important role to tying our medical education mission to our entire healthcare system and to our entire state. To our students, thank you for choosing the Tufts Main Track program. On behalf of our community, we couldn't be more thrilled with the class coming in and the work that you will do here through your education and as you develop into the future physicians in our community and more broadly. It's now my privilege to introduce my colleague, Dr. Amy Kulik, who is the Dean of Student Affairs at Tufts Medical School. Thank you, Amy, for being here.
Thank you, Jeff. So first of all, obviously, I missed the memo. This is Camp Week, and I came sporting my son's Camp Caribou sweatshirt. He spent about 10 years up in Waterville, Maine at Camp Caribou, and my daughter wouldn't let me leave the house this morning without my Birch Hill camp. She went there, and that's in New Hampshire. When you come to Boston, in just a little over a week, what you're going to find are elephants, because we'll leave moose and caribou up in Maine, and we are the jumbos down at Tufts. So good morning, and welcome to the class of 2025 Main Track students. From down here in Boston. You are entering an absolutely remarkable program at a challenging but important time in medicine. So we're still in the midst of a global pandemic, although on the waning end in this country, in some parts at least, the pandemic has laid bare the tremendous health disparities, racial inequities, and public health challenges that must be addressed. And in just over a week, you're going to begin to start addressing those problems. At the same time, our profession, including our medical students, have shown tremendous resilience, have risen to the occasion, and demonstrated a lot of empathy, flexibility, and creativity when we needed it the most. And so we have a lot of hope and much to be proud of. And actually, I can't think of a more important and fulfilling time to be entering our profession. I've been here at Tufts since the inception of this incredible partnership between Maine Medical Center and Tufts. And it was really led by inspirational thinking and leadership up in Maine. The idea that Jeff just told you about was a lofty one: to improve the health of the people throughout the state of Maine, making it the healthiest state, that's the goal, by increasing access to medical education for students from Maine and other rural states. Early on, the leadership described their vision that Maine Medical Center would not just be a branch campus for Tufts, but it would become an epicenter for health education that would expand throughout the state of Maine. The entire 35,000 square miles of it would be our campus. The leaders truly believed in the power of education, and they believed that hosting students at rural critical access hospitals would simultaneously invigorate practicing physicians, improve the quality of patient care, and provide a pipeline for the future workforce. And you know what? They were right. So from Portland to Skowhegan, to Mount Desert Island, to Caribou, Tufts Main Track students have left their mark, with nearly 50% of those who've completed their training returning to practice in Maine. So I welcome you to join their ranks. I encourage you to engage this year with your Maine cohort but also with your non-Maine track classmates, many of whom will become your best friends for years to come. I know when you look around the room right now, you don't know each other very well. You're going to be peers, confidants, friends, and when you leave here in 4 years, many of you will be couples matching together. You have a wonderful, knowledgeable, supportive group of peers, administrators, and faculty members who are on this journey with you. So welcome aboard. I can't wait to meet you a week from now down in Boston. I'd now like to introduce our next speaker, Dr. Doug Sawyer, who is the Chief Academic Officer at Maine Medical Center and the Academic Dean of the Tufts Maine Track Program.
Thanks, Dean Kulik. And while Dean Kulik is speaking to you from Boston wearing her moose, I'm speaking to you from Maine wearing my elephant tie, a Tufts School of Medicine tie given to me by the dean down there. And I want to welcome the class of 2025 to the Maine Track program. As both Jeff and Amy have mentioned, it's been over 12 years since we formed our partnership to found this program and address the shortage of physicians in Maine. And you can see from this map, which tells the location of the students that have chosen to come in the program, that we have been popular not only in Maine, but in New England and across the country. And we welcome not only our Mainers into the program, but maybe some of our new Mainers in this class of 2025. So the success and popularity of the program is undeniable. Many of our alumni are now coming back to practice after finishing the first graduating class in 2013, having completed their residencies and fellowships, are back in Maine. And as Dean Kulik mentioned, about 50% of the fully trained graduates are coming back to the state. So we are excited by the success of the program and what it's done for the provision of care in Maine. I also want to give a special thanks to our educational partners. As Dean Kulik mentioned, our faculty are throughout the state of Maine, as you can see on this map, which locates some of our sites where our students have spent time training. And these educators are clinicians who are dedicated to training the next generation of physicians, even making time during a pandemic to provide the time and energy and space for training. Our students are dedicated to education, and down in Boston at the Tufts program, our Maine Track students are recipients of many of the awards given out to the top students each year. This is the class of 2021 award and citations. Our faculty are equally dedicated. Each year, our Maine Track students award these awards to dedicated faculty who have impacted their training. And we're very proud of the faculty here. And many of them have gone on to be promoted in the Tufts School of Medicine along their professor tracks. I want to take a minute to really give a special thanks to someone who's been a real impact on education in Maine Medical Center and Maine Health, and that's Bob Bingu. Bob, shown here, has been leading in medical education for over 2 decades and has had huge impacts, not only in the Tufts Maine Track program, but our graduate medical education programs and our faculty development. Bob started his career in Maine in 1986 after graduating from George Washington University School of Medicine, and then completed a fellowship in endocrinology here, and has been an active member of the faculty and staff for the past 35 years, essentially. So we're really delighted that Bob is not actually sailing into the sunset, but actually staying on in a different capacity as we welcome in our new VP of Medical Education from the University of Rochester, and that's Linda Chaudhran, shown on the next slide. Linda comes to us from a illustrious career in medical education, and she will be the inaugural Robert G. Bingu Chair of Medical Education, thanks to the generosity made possible by Bob Bingu and his wife, Janet. So today's lecture is named the McKusick Lecture after Victor McKusick, and we're delighted to share these lectures with members of our community, but in particular the McKusick family, some of whom are with us today in the Zoom room, so to speak. Victor McKusick was from Maine and had an illustrious career in medical genetics, making huge contributions. He was born in Parkman, Maine, a dairy farm with his twin brother, Vincent. And Vincent went on to become an illustrious lawyer, while Victor trained at Tufts before going to Johns Hopkins Medical School and then staying at Johns Hopkins throughout his career. He was a pioneer. He envisioned a day when human genome would be mapped and we would be able to understand the molecular basis for disease using that information. His early textbooks were instrumental in educating medical genetics throughout the world. And this later morphed into an online resource that I encourage all of our students to learn about so they can learn more about the career that Victor had and the impact he had on medical genetics. That website is called Online Mendelian Inheritance in Man, or OMIM for short. And I can't go a week on clinical service in cardiology without spending a few minutes on OMIM, looking up some syndrome, trying to understand what's new about the genetic basis for a disease. I'd like to give all the main track students a piece of homework today. I want you to all log into OMIM. You can Google it, OMIM, and look up some syndrome, or maybe you have a favorite gene. I do, mine's is Titan. Look up your favorite gene and see what's known about how it links to illness via this resource that Victor McKusick created for us. So it's really a pleasure for me to introduce today's McKusick lecturer. Dr. Andy Mueller came to Maine Medical Center and Maine Health in April of this year, joining us as our CEO with an outstanding background in leadership and service to medicine and our country. Dr. Mueller received his medical degree from the University of North Carolina School of Medicine in 1996 and joined the Air Force, where he completed his residency in family medicine at the Malcolm Grove Medical Center at Andrews Air Force Base in Maryland. He served as chief resident in family medicine and was a staff family physician and flight surgeon with the 437th Medical Group at Charleston Air Force Base in South Carolina. After leaving the Air Force, Dr. Mueller practiced as a family physician before embarking on a career as a physician executive, first at Novant Health, a large healthcare system spanning 4 states based in North Carolina, and then followed by time at Centra as CEO and president at Lynchburg, Virginia, multiple hospital healthcare system. We are delighted that Dr. Mueller, or Andy as he prefers to be called, is leading Maine Health. Thank you, Andy, for taking the time to be the 13th McKusick lecturer and sharing your wisdom and experience with the Tufts School of Medicine Main Track class of 2025.
Well, thank you, Doug. And it's for all of you in the class of 2025, you cannot possibly imagine just how important you are to all of us, because you really are the future for our patients, for our community, and play a really, really big role in that. So I got to be honest, I was really kind of surprised and shocked that Doug asked me to speak to you today. And as I thought about what could I possibly say that would add some value and create some relevance for you, I thought about putting myself in your shoes and thinking back to the days many, many years ago, right before I started medical school. And I thought about, man, would I go back and do that again? And before I thought about that, I thought about, would I go back and do that again? And what would I do if I only knew then some of the things I've learned and some of those things that come with age and experience? So I made a list of all of those things, and it was a lot because I didn't know much then and certainly know more now. But I whittled it down to 6 things that I think I really wish someone would have explained to me before I went to medical school. And yeah, there's a little selfishness in me too around some of the things that I hope that you will take with you as you embark upon not only your educational career, but ultimately your career in practicing medicine. So the first of those things, which I think is so critically important, and I did not understand this when I was starting medical school, is to really know your purpose, know what motivates you, know what drives you, and know why you do what you do. I started my career practicing in the military, practicing aerospace medicine. And I don't know if I was exactly the best Air Force officer. There were parts about the military that I found difficult, but I really loved practicing aerospace medicine. And I was considering making that a career. And then after serving overseas, being deployed in support of Operation Enduring Freedom, I came back and I just couldn't quit coughing. And I coughed a lot when I was younger. And my boss, who was in the next office, another physician, one day came in and said, Andy, you got to do something about this. And that ultimately led to a diagnosis of asthma. And while that was appropriate and great for my health, it was devastating to my career ambitions. And so ultimately decided to leave the Air Force and went into practice with a large integrated healthcare system. And I hated getting up in the morning. And I would get up in the morning and think about going into the clinic and seeing patients. And I saw them as a long list of items to do. So I would have to initiate the conversation, make a diagnosis, prescribe a treatment, give aftercare instructions, write a note, submit a charge, and then rinse and repeat and continue to do that every day. And it took me a while to realize that I had lost the connectedness to why I was doing what I was doing on a larger scale. And in the Air Force, it was easy for me because I could connect why I was caring for the pilot in front of me, and ultimately what the objective was to ensure that they could ultimately fly safely to achieve the aims of the Air Force in helping us uphold and defend the Constitution of the United States. And while I don't know that I could have articulated that connection with the purpose while I was serving, the absence of it was devastating to me afterwards. And slowly over time, I don't think it was an instantaneous event, I began looking at the world differently. Instead of thinking about waking up every day and going to care for patients and try to make them better if they were sick or try to keep them well if they weren't, I began to looking at my life differently and began to see that every day I had the opportunity to really make an impact and enable people to be their very best. And over time, that really became my personal purpose, and it still is today, enabling people to be their best. And I think about that being true, whether it's in a patient room, I think about whether that's true in an executive capacity. Thinking about how I can try to empower people to be better. And so it wasn't always about prescribing medication. And a professor in medical school had so wisely informed me of my future purpose. I just wasn't smart enough at the time to listen and appreciate it when he once said, Andy, our jobs as physicians is to treat those patients who need to be treated and help those who don't. And I think in a lot of ways that really reflects my own personal purpose. I hope that each of you can find that. For some, it may be based in faith. For others, just a deep sense of service. It may be about connecting with people. Whatever it is important that you understand what deeply motivates you so you can connect what you do to the why that you do it. And if you don't, life can be really, really hard because there's a lot of what in practicing medicine. So spend some intentional time in your next 4 years thinking about why you do what you do. Now, to be clear, my hope is you want to do something fairly altruistic and make a difference in the world. But if that's not what motivates you, if it is something like money, then be honest with yourself, because I think the only thing worse than not having a purpose is not having an authentic one. So spend some time in the next few years and think about what really motivates you and why you do what you do. It'll serve you very well moving into the future. The second thing I'd like to share with you is my impression about what patients want. And it's interesting, all of you should be so congratulated on achieving what you've achieved in gaining admission to an incredibly prestigious academic medical center and medical school. But in all the years I practiced medicine, I can probably count on one hand, maybe one finger, the number of times a patient engaged me about where I went to medical school or where I did my residency or my credentials. I think in the eyes of most patients, if you're a licensed physician in whatever state you're practicing in, you're probably good enough. But what I have seen over the years, those physicians who are successful, and not only successful in terms of number of patients or monetary achievement or whatever it may be, but those who also really continue to find joy in the practice of medicine, really exhibited two qualities that I think are critically important. And I think they're the things that patients want the most. And that is, they want you to be honest and they want you to practice with integrity. And they want you to tell them the truth. And you can always find a way to tell the truth respectfully, with dignity, and with empathy. And then they want you to practice in a way that's tied to some sort of moral framework. And they're counting on you to do that. And I think for each of you and all of us collectively as a profession, we owe it to our patients to do that. And they are seeking that. And if we fail to provide that to them, then frankly, the practice of medicine, it won't exist forever. So I know that's a lot and a big obligation, but it's an important one. And don't ever lose sight of that. When I was in medical school, one of the things that I was very intentional about is I didn't really want to hear anything about the business of healthcare or the economics of healthcare. And I'm not sure we actually were taught anything about that when I attended medical school. But if it was taught, I wasn't paying attention. But that was a mistake. And not a mistake because it's so important, but a mistake because it is important. We unfortunately can't divorce the economics from what we do. And I'm not telling you that to serve your own purposes to make more money, although it might help you do that. I'm telling you that because we're all naive to think that economics don't influence how we practice medicine and ultimately how it impacts the patients that we care for. It does. And so it's important that you understand that. It's important that you have a curiosity about that. And it's important that you ask questions about that to try to make sure you understand how economics are influencing your ability to care for patients. Not to do so, you'll be completely unaware of what's happening around you. And that can ultimately, without intention, let your patients down. The other part of the economics equation, which took me a long time to appreciate and recognize, but now I simply can't ignore it, is the fact that an individual's health is largely tied to their economic state. And as Dr. David Nash, who leads the College of Population Health at Jefferson Medical College, likes to remind us all, he states, I can probably have a greater likelihood to predict someone's longevity if I know their credit score and zip code above and beyond their blood pressure, their cholesterol, and their hemoglobin A1C. But those two things are more important. And there's a strong tie between economic prosperity and health. And you need to be aware of that as you care for patients from varying socioeconomic backgrounds and recognize that their behaviors are largely going to be influenced by their economic circumstance, including those behaviors that will influence their health. And that's true whether you're a primary care physician like myself or whether you're a specialist or proceduralist. There's no question that the economics that impact the patients are going to impact their health. So be curious. Ask questions, and don't consider that, like I did, something completely detached from science and the care of patients, because it's not. It's completely integral. I remember thinking back about what medical school is going to look like and what I would come out on the other end capable of doing. And one of those things was thinking about what it would mean to save a life. And I want to challenge each of you to do that very thing, save a life. In fact, saved many lives. And when I thought about what saving a life would be like or look like, I had this vision of myself running to the back of a commercial airliner and resuscitating somebody who had collapsed by administering epinephrine or defibrillating them and performing advanced cardiac life support and bringing them back heroically, or doing something similar in a sporting event and really helping, in a heroic manner, bring them back to life. And I recognized then that the likelihood of that happening was small, and I wouldn't get many opportunities to do that. But when I look back now at my career as a physician, I just look back at that image of myself that I had as a medical student and just realize how wrong all of that was. I've had the opportunity to save way more lives in an acute fashion than I would have ever thought. And it didn't look anything like that. It didn't require heroic. It was not nearly as dramatic and as theatrical as I envisioned in my head. And the way I've been able to save more lives than I care to count is by having the courage to just simply ask a question. Have you thought about hurting yourself? And you will be shocked when you do just how frequently the answer to that question is yes. There is simply no way to escape the fact that there is only one organ that touches every part of or is connected to every part of our body. And it's our brain. And the brain's highest functions are thoughts and feelings. And we are kidding ourselves to think that we can really engage effectively with patients and give them an opportunity for their best outcome if we're not willing to get to a patient's state of mind. And I say this completely reformed because I won't lie to you, I hated my psychiatry rotations as both a medical student and as a resident. And I promised myself that when I left residency, I was just going to have one of those family practices where I just wasn't going to deal with a lot of psychological conditions. That's really what I thought back then. And you can only imagine how that worked out. And the reality is that all of us, every single one of us, in some form or fashion, at some point in our lives, is impacted by mental illness or mental health issues. And so it's so prevalent that all of us are going to deal with it. And it doesn't matter if you choose to go into orthopedics because bones can't talk back to you, or you want to be a general surgeon because everybody's appendix looks the same. If your goal is to try to avoid the conversations around mental health, my best advice to you is good luck with that, because you won't be able to. And in fact, thinking about it and segregating behavioral health the way we have as a profession and an industry, it just doesn't work. It's got to be brought into every single thing we do. And I was scared and nervous the first time I asked that question. But you'll develop the confidence in doing it. And doing it is so critical, particularly in our society today, where the stresses and strains of our current environment are really taking a toll on all of us. Volumes in our hospitals have never been greater. And yes, there's a good portion of that is connected to deferred healthcare and in the aftermath of a pandemic. But there are also a lot of patients in our hospitals that are exhibiting the somatic manifestations of mental health issues. And we can't ignore that either. And so we owe it to ourselves as a profession to think about how we can really connect to every single patient, every step of the way, every time. The fifth thing I would like to share with you is a concept that I think has served me well over the years. And while I think I had some element of this when I was considering just starting medical school, the importance of this has been reinforced so much over my lifetime that I just think it's important to share with each of you. So Clayton Christensen, who taught at the Harvard Business School for years, published a paper in 2010 in the Harvard Business Review entitled, "How Will You Measure Your Life?" And in it, he shares a concept in which when you're young, those people who are around you and you surround yourself with, your parents, your teachers, are all older, more experienced, and smarter than you are. But by the time you've graduated from a major university and now you're on the precipice of your medical education and about to graduate from medical school, when that day comes, you're going to realize that there aren't as many people around you who are better educated, in some cases smarter than you are. But if you only reserve the opportunity to learn from people smarter than you once you graduate medical school, your opportunities to learn are going to be severely limited. Don't forget that you can learn something from everyone, regardless of how accomplished you are. Bringing a healthy dose of humility into every interaction is so critical, and it's especially true with your patients. Your patients will teach you a lot. And I'm not just talking about the fact that they understand their health better than you do, and they will. But I'm talking about helping you learn about life and just how to conduct yourself and just how to go about your business. And so will all of the people who surround you as members of your care team. They will teach you a lot, and they will have great ideas, and they will help you provide better care for your patients. You've just got to have a willingness to listen to all of them. And sometimes listen to them when what they're telling you is uncomfortable. It's so important that you do that, and it will serve you well into your future. So probably the most important thing I've saved for last. And so if I had to look back before I started medical school at what I had ahead of me, probably the most important thing I can tell you to do is just relax. You've made it. You've been accepted into a prestigious medical school and a great academic program. Our admissions committee knows what it's doing. None of you should ever have imposter syndrome, although you think you might at some point, you don't. Our faculty are amazing. They're going to give you an incredible education. By the time you graduate, you're going to be a well-trained physician. So sit back, relax, enjoy the next 4 years. They're going to be so special and so remarkable. Knowing what I know now, going through what I've gone through professionally, when I go back and do it again, oh my gosh, in a heartbeat, you are going to have an opportunity to do something so special. People are going to trust you with their most precious thing, their health. And you're going to have an opportunity to make a massive impact in their lives and the lives of the communities you serve. And you're going to have an opportunity to have a rich and rewarding career that I can't even begin to describe. Just the specialness of. So enjoy the next 4 years, soak it all in. Don't worry about the little stuff. You'll get through it. And in the end, go out and do something really great. Thank you so much and congratulations.
Andy, thank you for sharing those words. When you were talking about number 5, I think it was, learn from everyone. You'd be happy to know that our students during their 3rd year are encouraged to bring a patient forward and come on a Saturday and nominate them as patient as teacher. It's a great program that I hope we can get back to. We had to, because of social distancing restrictions, had to not do that the last year and a half. But we look forward to welcoming you to that next session of patient as teacher.
I would love that.
We have time for some questions for Andy. And I guess while people are putting questions into the Q&A chat, Andy, you mentioned in number 3 about how economics has such an impact on health. And in that term, we teach in med school now the social determinants of health. How do you see, in your experience and then your vision for the future, how do you see a health system help dig in on that, given our true north is to improve the health and wellness of our community? How do we help address some of those social determinants of health?
Yeah, we've got to be real about that. So it was in 2019 that the Department of Commerce, or actually the U.S. Treasury rather, commissioned a study that found that 60% of Americans can't liquidate $400 to cover a medical expense. Yet the average out-of-pocket deductible for most health plans across the country is $1,400. So any medical, any exposure to the healthcare system financially for any patient can be devastating. So as we think about achieving our vision of working together so our communities are the healthiest in America, we've got to consider how we create affordability. And some of that ultimately will be around how we think about how we price our services in our marketplace. But a lot of it is just really about creating the right access, connecting with patients in the appropriate setting, and thinking about how we can use technology increasingly to allow us to do that, particularly in some of our more widespread rural communities. Because there's a lot of, there's still in this day and age, a lot of care that occurs in venues that it doesn't need to occur in, and that drives up utilization, which has the biggest impact in driving up the cost of care. And so I think we've got lots of opportunities and ways we can think about how we can drive down that care over time.
Thanks, Andy. We do have a question from Deborah Moore. Can you share a story of something you've learned from a patient about life or about their own understanding of their health that perhaps you overlooked? It relates to number 5, to listen and learn from those around you, including your patients. Thanks for the
Oh,
question.
gosh. Yeah, it's hard to pin that down on just one because there's so many life's lessons. But I'll tell you one that just sort of jumps to mind. I remember when I was a resident, I got called to the emergency department. And I was doing an OB rotation, and it was a hard, long day. We had a lot of deliveries. It was probably 1 a.m, and I just laid my head down. It was a Saturday night, Sunday morning, and the pager goes off. I'd probably just fallen asleep, probably like 1:30 and fallen asleep. And I was a little bit irritated that I just had to get back up and go down to the emergency room. And so I go into an emergency room at that time in the morning on a Saturday, and for a gynecologic emergency. And I remember walking into the room, and the woman there in front of me looked completely fine. And I'm envisioning going into the emergency room. Is this an ectopic pregnancy? Is it, pelvic inflammatory disease? Is it something really, really horrific? Her vital signs looked all normal, and she looked at me and said, "Doctor, how come I can't get pregnant?" And I remember sitting there thinking to myself, why am I getting woken up in the middle of the night to answer this kind of question? But something kind of hit me that night, and I began talking to her a little bit. And as I had the conversation with her, I remember her ultimately talking about what brought her in that night. Got to the point where I felt comfortable asking her that question. And the problem was she was in an abusive relationship, and her partner was abusing her over the fact that she couldn't get pregnant. And what really brought her into the emergency room wasn't a gynecologic emergency. What really brought her into the emergency room was an emotional emergency. And I think that was one of the first times that I really clued into the fact that really a lot of what drives behavior isn't going to fit into the categories that we like to think about how we want patients to engage us, and that we've got to sometimes think differently about how we engage them in a way that's more meaningful to them than it might be for us in the moment. So she taught me a lot that night, and I remember her frequently.
Thanks for sharing that. That reminds us of that old adage that it's usually the last question that's the most important. That makes us all need to be mindful of spending as much time as possible with our patients. We have a question from Bob Bingu. How will the new Maine track students help Maine become the healthiest state in the United States? Thanks, Bob.
So I think there are unlimited ways. So one of the things that delights me the most about Maine Health, I think, is our academic mission. I think it's vital to our future in so many ways. We've got to train the next generation of caregivers for our state. And we're in a state that I think just by our demographics is going to be challenged in that way. So we're very fortunate to have a group of medical students that would consider coming to medical school here, have the opportunity to really experience the state, hopefully decide to stay and continue to practice here. We also have to continuously push our thinking. And so by attracting some of the best and brightest, and you all are, I think you can push us in helping us think about how we can do that better. So we need innovation desperately. We need good ideas. And I think there's a great opportunity for each of you in your time with us to help us think about how to do things differently. Do not hesitate to point out things that you think may be obvious, but nobody else is thinking about. And don't hesitate to challenge the status quo and ask hard questions and make sure you understand why we're doing what we're doing. And don't take just because as an answer. Any of us can ease into that if we're allowed to. So you hold us accountable. Don't let us just give you just because, or we've always done it that way as an answer. So challenge the way we think about things and think about how we can help us make it better for our patients. And I think that's one of the best ways you can make an impact for us.
Thanks, Andy. I think with that answer, we're going to be recruiting you to join the faculty of the administrative elective that the fourth-year students sign up for. So we have a question from Susan Santangelo, one of our research directors, asking for your thoughts on the role of clinical and translational research at Maine Health and its affiliates, particularly in more rural areas. Do you have any ideas about how Maine Health might help to support such research in some of the more under-resourced departments in rural areas?
Yeah, I think so. I mean, I think we've got, so our industry, to be clear, our industry has not figured out rural health care yet. I think we have an incredible opportunity here at Maine Health to really help lead that conversation and discussion. So there is no question in my mind that we are going to have to research different care delivery models. We're going to have to understand how we provide a level of care that we all feel really comfortable with in our rural communities, where we are going to continue to be resource constrained. We're going to have to understand how we can deploy technology and how we think about technology, particularly in areas where we lack broadband capability, to be as effective as we might in a metropolitan area, to shape how we deliver that care. And there's no question that my hope is that over time we can be involved in developing new ways of delivering care, new therapeutics and other things that may make an impact, particularly for some of the chronic conditions that plague some of our rural communities. And going back to what I stated earlier, there's a clear connection between the economics of a community and health outcomes of a community. And in many cases, we may have opportunities through our innovation center and other things to help stimulate business development as a result of some of our research. And if we can do that, we're going to raise all boats in the state. That's important.
That's a great answer. And I think you'll probably get asked that again because Andy later in the week is going to be visiting the Research Institute. We have another question coming in. Can you share advice on how you would cope or respond to discouragement when you felt you didn't fully treat a patient or address their problems as well as you could have?
Yeah, that's going to happen. So first of all, you're going to kill yourself trying to really do the right thing. There's no question about it. You are. You're going to work really hard to always do the right thing for patients. And there are going to be some times, despite your best efforts, you're not going to connect with the patient. You're just not going to be on the same wavelength. And don't beat yourself up about that. And I did for a long time. And I remember a patient that I just felt like I had gone so far and above and beyond for when I was in the Air Force. And despite every attempt I had made, connecting with this patient on weekends, trying to make sure we refer to the right spot, just doing everything I could, ultimately filed a complaint about myself and others not living up to her expectations, and really had to sit down with a more senior physician to understand what I could have done different or better. And his advice was, Andy, you've done, I don't know what else to tell you. You've done everything you could do reasonably and rationally and respectfully, and you've just got to let this go. And there are going to be those times. But one of the things that I got in the habit of doing every time I would see a patient is when the time came for them to leave the room, I would always just stop for a second and say, are you comfortable with what we discussed today? Did I meet your expectations, or is there anything else you feel that we need to address? Just to open the door and give them an opportunity to say more. And more often than not, they wouldn't take advantage of it. Every once in a while they would. And if they did, usually something good would come from it. And so I just always became very intentional about trying to make sure that they left feeling satisfied. Sometimes I'd ask that question, are you satisfied with what occurred today? Just to try to gain insight into what they're thinking, because sometimes they do have different expectations. And sometimes patients, they're people like us, they're just like you and me. And they may have a hard time explaining exactly what they're looking for, but by asking that question, you give them an opportunity to address it further.
Thanks, Andy. I think we have time for one more question, and then there is another question in the chat that Becky Bucci asked that I'll get back to Becky with answers to that because it's specific to the Maine Track program. But Joy Stewart writes, how can families best support medical students?
Oh. I think that's a great question. I think in many ways, your students are going to become very intensely involved in their education. They're going to spend all of their waking time studying, focused on it. I think there are a couple of things, parents, family members, spouses, brothers, sisters, partners can all do to support their loved ones who are studying medicine. I think just to kind of pull them out of the weeds sometimes and just provide them context in life and reconnect them with the rest of the world, I think is a healthy thing. So if they love to go fishing or canoeing or whatever it is, and they come up, go take them out and do that. Reconnect them with the rest of the world, get them away from from medicine and healthcare. Sometimes they're going to want to continue to focus on that, and that's not always healthy. They need to learn how to recharge their batteries. And so remind them of that and get them away from medicine, I think, is sometimes healthy. And I think, going back to what I stated, first thing in the talk, help them figure out how to connect with their purpose and their why. Because you know them really well. You understand what makes them tick. You know what motivates them. And if you see them getting away from that, or you see them having difficulty reconnecting why they're studying medicine back to that, you probably more than anyone else can help them reconnect to that. And that will help them get through whatever they have next. And tell them the last thing I told them, just relax. They're all great. They wouldn't be here if they weren't. And I can't stress that enough. Our admissions committee knows what they're doing. These are all of these incredible people deserve to be here, should be here, and will be successful and be fine. And just remind them of that too. Just remind them how special they are.
I think that's great advice. And for all those families who got to listen today, hopefully you took some notes like I did on Andy's top 6 picks. So thank you, Andy, for a great discussion and really wonderful thoughts that you shared with our students today.
Yeah, it's been great to be here.
It's my pleasure to introduce Joe Linder, our Assistant Dean of Students for the Tufts Main Track program, who will now take over the program.
Thank you, Dr. Sawyer. And Dr. Mueller, your talk was so inspiring. I know you prefer to be called Andy, so thank you, Andy. It's been my privilege to be a part of this annual tradition since our partnership began with Tufts in 2009. This year, I'm excited to welcome our new Director of Student Affairs, Dr. Allison Samet, to introduce our incoming Main Track class.
Thanks, Dean Linder. I am so happy to be here, and I'm thrilled to be able to officially welcome the Tufts Main Track class of 2025. In a typical year, we would all be in an auditorium together and the students would be introduced in person. We have something I think it's even better to share with you now, which is a video of the students introducing themselves. So instead of seeing them across a darkened auditorium, you'll get to see their faces up close. I'm very pleased to welcome these 42 amazing future physicians. 20 of them are from Maine, and the rest hail from across the country, including as disparate places as California, Montana, Iowa, and New York City. They're a great group, and they are going to be wonderful additions to our communities. Without further ado, here is the Tufts Main Track class of 2025.
Eli Babcock, Cape Elizabeth, Maine.
Michael Bennett, York, Maine.
Kayla Bronzo, Corte Madera, California. Cece Bush, Deerfield, New Hampshire.
Fern Calkins, Oakland, Maine.
Catherine Call, Scarborough, Maine.
Camille Madeleine Clancy, Washington, D.C.
Jennifer Coates, Hudson, New Hampshire.
Mariah Dawson, Berkeley, California.
Amelia Denny, Waterville, Maine.
Nick Donaldson, Brownsville, Vermont.
Amy Eklund, Kennebunk, Maine.
Julia Fossa, Hamden, Maine.
Zachary Gothier, York, Maine.
Catherine Janelius, Helena, Montana.
Nicholas Hawsey, Buxton, Maine.
Tyler Hinckley, West Gardner, Maine.
Alex Jensen, Waterville, Maine.
Catherine Lebec, Saco, Maine.
Amanda Massey, Portland, Maine.
Dana McCarney, Manhasset, New York.
Peter Mikalakis, Portland, Maine.
Anne Marie Mullen, Barrington, Rhode Island.
Rory O'Connell, Amherst, Massachusetts.
Eileen O'Shea, Portland, Maine.
Hi everyone, my name is Joshua Parbs and I'm from Urbana, Iowa.
Joshua Passarelli, Scarborough, Maine.
Eden Pete, Downingtown, Pennsylvania.
Carrie Quigley, Newburgh, Maine.
Ian Richards Roy, Osterville, Massachusetts.
Anna Saucier, Bethel, Maine.
Maxwell Seneschal, Saco, Maine.
Amy Schoberg, Groton, Massachusetts.
Bradford Sokol, Rockford, Michigan.
Emma Stevens, Napa, California.
Austin Stewart, Orono, Maine.
Isabella Stone, Concord, Massachusetts.
Peter Cow, New York, New York.
Emily Thunberg, Concord, New Hampshire.
Elizabeth Vinton, Lindenville, Vermont.
Doug Wary, Portsmouth, New Hampshire.
Annika Williams, San Rafael, California.
Well, congratulations, class of 2025. On behalf of all the faculty, we're delighted to welcome you as you embark on the next phase of your education and training to become physicians. We look forward to working with you to improve the health and wellness of our communities and to learning from you over the course of your training and careers in medicine. This concludes the 13th annual McKusick Lecture. Thank you all for attending.